Hello, this is Dr. Michael Lau. I would like to discuss with you the procedure which we call regenerative facelift. So it's a non-surgical procedure. We're using regenerative aesthetics to achieve similar result as a surgical facelift. As we get older, what happens is the skull and the facial bone structure will tend to shrink, and over time the shrinkage will result in a size difference between the overlying tissue like skin, fatty tissue, muscle, and the bone. So it's just like wearing a size 8 dress over a size 2 frame. So you can see that's why the skin will start sagging with gravity, and you have lines and all sort of challenges that with aging that you see on the face. So in surgical facelift, what we usually do is we will make an incision along the line around the ear, behind the ear, so you won't see the scar that well. And then you dissect and go underneath the skin and the subcutaneous tissue. Some procedure will tighten and suspend the subcutaneous soft tissue and fixation, and then you excise the excessive skin and approximate the incision and pulling the skin back so that it will smooth the line out and overcome the sagging appearance. So what we are proposing is to use regenerative technology to offer an option, alternative from the surgical procedure or facelift. Now, I'm Dr. Lau. I am a scientist, also a surgeon, and also I develop beauty tech. So I'm the guy for you to talk you through the process of regenerative facelift. I started as a PhD student in nuclear physics and chemistry at the University of Washington. And I've been involved in technology development over the years while being a surgeon. I'm the first one to use laser in surgery more than 30 years ago in the Pacific Northwest, and also developed several devices, including a beauty device called Janu, using ultrasound to help deliver active skincare agents. So what are the technologies we used to replace the surgical facelift? So I think what you want to do is, one, improve the tightness of the skin to get rid of lines and sagging. Actually, also improve the texture and appearance of the skin. And secondly, you want to change the contour of the skin. So what we do is we use regenerative microneedling technology. So using microneedling to deliver active ingredient, growth factors and healing factors from exosomes, which is a nanoparticle that carry growth hormones that derive from tissue, stem cells. Stem cells are derivative or are PRP, platelet-rich plasma. Those are all regenerative property to help the skin, to tighten the skin and also make it look better with better texture. And we can use energy devices, radio frequency, with mechanical assistance and infrared energy to heat up the tissue deep to generate tissue healing, remodeling, with, again, encourage growth and healing factors, and also tighten the tissue in the interim. Also, after that, we can also supplement by injecting dermal fillers to change the contour of the face by giving fundamental changes of the skin cells, but also give foundational support to improve the contour. So how do we do regenerative facelift? So we apply the microneedling regenerative technology covering the face and the neck that will improve the skin texture, appearance, and tightness. And you add to the radio frequency system. In our case, we use VelaShape 3 to tighten the skin and also change the contour by selectively decrease the local fat pocket and change the contour and tighten the jowl line and then the skin of the neck. That will improve the contour. And then after that, we strategically place dermal filler to help strengthen the support, like for example, around the arch in the area we have been getting decreased in size over time because of aging. So that will regenerate the skin support, the skin appearance, and the skin tightness from face and neck down, and do similar things that a surgical facelift will do, except we will actually help you improve the skin texture and appearance, and it will last for a long time because of fundamental change of the skin cells. So as far as the regenerative technologies are concerned, we use microneedling with PRP, platelet-rich plasma. I saw a new concept. I've been using PRP for more than 20 years, using fat transfer to the breast and also other surgical healing procedure. Using PRP for facial, popularized by a lot of celebrity, called vampire facial, vampire facelift. It actually works real well. Even FDA recognized that it works, and it was done under the direction of a physician as a procedure. Medical procedures fine with them. And the PRP contains a lot of healing factors and growth factors, work really well, really effective. You can see the result almost right away. Really not much downtime at all. Just example of this, the dramatic change of the facial skin and tightness after treatment of the microneedling PRP. We are investigating other regenerative factors now. The new things are exosomes or stem cell and stem cell derivatives. They're very effective. Not quite approved by FDA, but can be used as investigative supplement. Now, we have been using heat energy with radio frequency, RF, electric energy, or using laser energy to help the skin to rejuvenate by simulating growth and growth factors and healing factors. We use the VelaShape 3 system in our clinic, which is radio frequency plus a vacuum to help deliver energy deeper and infrared as well. Basically, we stimulate new collagen and elastin production, resulting in reduced in skin laxity and overall improve the skin texture and look, but also the tightness, and more importantly, help to dissolve some of the, reduce some of the local fat deposits to change the contour and tighten the skin at the same time as well. So here are some results. You can see the upper picture show a neck VelaShape 3 treatment. You can see the reduction of the contour and of the neck, tighten it and provide a better jowl line. And the lower pictures actually show very dramatic improvement of VelaShape 3 treatment in the abdomen to decrease the fat deposits, improve the contour, tighten the skin, and make the stretch mark less obvious. So we can apply the same technology in the case of regenerative facelift. So to summarize the regenerative facelift, what are the advantages? 1, it's not surgery, it's non-surgical. 2, it's very comfortable, fast recovery, no downtime. You can go back to work activities right away. It's very cost effective and also make fundamental tissue improvement for long-term effect, including skin regeneration, rejuvenation, and besides tightening. So I think it's a very effective alternative to surgical facelift. I will invite you to go into my YouTube video library, subscribe to it, and follow up. I provide weekly update, especially in the Understanding Beauty Tech series, which explain the basic scientific and technological background of why these procedures work. Thank you for your attention. Take care.